Good afternoon, everyone. A very warm welcome to each one of you. Today, we are hosting a webinar on everything to know about breastfeeding. As you all know, it is World Breastfeeding Awareness Week that was happening, and ReeLabs is always extremely pro and supportive of helping each mother achieve their breastfeeding goals, whatever they are, whether it's 1 day, 1 year, 5 years, whatever it is. We are here to help you through each stage of your breastfeeding journey, and we've always tried to host such initiatives which are informative and supportive to help you achieve that journey. And Sushma ji has been an integral part of that support. She is a certified childbirth and lactation educator, and her answers and her support have been extremely helpful to all mothers around whoever has asked her any question or seeks support. So, continuing with that initiative, we have today's webinar. Welcome, Sushma ji. Let's begin.
Thank you. Thank you. Thank you so much, Saloni. It's a pleasure. Again, ReeLabs Wellness is, working towards creating groups, working towards doing all these webinars for pregnant moms, for, breastfeeding moms, for parenting parents, parenting and everything. So I believe that you're doing an excellent job. And thank you for this opportunity. And we are talking about, as August has the breastfeeding week, we have the breastfeeding month as such. Uh, a lot of people talk about this, but a lot of moms are also very, very uh, apprehensive sometimes because there is a lot of vague ideas about, as you cannot measure breast milk, they always think about, is my baby getting enough milk? What if my baby is not getting enough milk? Should I supplement and all? So there are so many questions in all the mothers' minds, and we are here to address that. So after the session, please feel free to either ask your question on chat or you can just, unmute yourself and you can ask to us directly. Thank you. Let's begin. So, coming to the first thing, what is breastfeeding? Breastfeeding is as simple as the fact that your baby gets only breast milk and no other liquids, like no formula or anything at all, except the vitamins or the syrups or the drops that is suggested by your pediatrician. So that is exclusive breastfeeding. Sometimes it may be almost exclusive, like you may give a certain amount or maybe a certain limit of other products, okay, which is mostly, like you call it, almost exclusive but not exclusive. Okay, so exclusive breastfeeding is where the baby gets only breast milk, nothing else, no formula, no water, no solids, nothing. The second one is when you start solids and stuff like that, then it is called almost exclusive. So this is just a definition. I'm sure all our moms know about this. So I will not spend too much time on this. Coming to the next thing, what is the recommendation of UP? American Association of Pediatrics suggests that you should have exclusive breastfeeding. It is sufficient to support optimal growth and development for the first 6 months of your life. The first 6 months of your life, your baby gets everything that it needs from your breast milk. And as later, when we'll be talking about this, I will tell you how breast milk changes to actually go according to your baby's needs. Breastfeeding can be continued till first year, and some mothers also breastfeed till 2 years. But then that depends on you and your baby, how you want to go about it. So first 6 months is something which is very, very important and recommended. Of course, it is also recommended that you start solids at maybe 6 months And then also breastfeed your baby for at least a year. Again, as I said, that depends on the mom and the baby for how long they both want to continue to breastfeed. So this is just recommendations, but there are reasons to it, and we'll go about. Coming to the second, to our next screen, what do we mean by golden hour? So now golden hour is basically called the first hour after birth of your baby, which is in the hospital or home or birth center, wherever you have your baby delivered. So first hour, golden hour means the first hour, but that doesn't mean the golden hour goes away. If you had a C-section and you're in the recovery room, the doctors and the nurses can still help your baby latch on. Also, even if it goes from the first hour to the second hour, it's absolutely okay. There is no, there is not like a clock ticking and then, within the 1 hour, if it's not done, the benefits are gone. It's not like that. So even if it's 1.5, 2 hours, at least your doctors and your nurses can help you with early initiation of breastfeeding. And trust me, that will help you a lot. So, first of all, it promotes your skin to skin bonding. So, it's lovely, isn't it, to see your baby after 9 months on yourself? It's a great feeling. Also, the fact is that once the baby comes out, it was in the womb, in the amniotic fluid. So, once the baby comes out, it always helps to keep the baby on the chest of the mother because it regulates body temperature of both the mom and the baby. So, what it is always suggested is that you just keep the baby bare chested on mom and just then cover them with a sheet. So, the mom has also gone through a lot, right? She has also gone through like delivery, she must have gone through pain, she must have gone through, uh, you know, maybe a long labor, hope not, but yes. And she must be also tired, so she'll also be feeling cold. So this is how it helps to regulate the body temperature of both mom and baby. It definitely helps in decreasing bleeding after birth. Initial bonding can take place. Come on, which mom would not like to see her baby, touch her baby, feel her baby? Which mom? And also, this helps in increase in prolactin and oxytocin levels, which actually helps in your breast milk coming out. So, this is all the things which are good. And nowadays, a lot of hospitals actually help with all of this. Even if you're making a birth plan, I would always suggest that write this on your birth plan because this will definitely help you. Coming on to our next screen. So that's the golden hour. You've been in the hospital, maybe for a day, maybe for 2 or 3 days if you've had a C-section. But the fact is, when you come home, this is something that you have to work on. So I always say that breastfeeding may be natural, but it doesn't come easy. There are a lot of moms who struggle with the latch. See, even they are learning. New moms are also learning. The baby is also learning. The moms are also learning. So the fact is that once you come back from the hospital, because in the hospital you have nurses, you have doctors to help you actually don't realize till the fact that you come home. And then you realize, okay, now this is what me and my baby has to work on. I always suggest if you are in the hospital, please ask all your questions from your doctors. Like literally, उनसे सब कुछ पूछ लो. Breastfeeding, latch, everything. How does my baby, how is my baby like, full of milk? Do I know or do I don't know? How much is my baby's stomach? Because we always think that colostrum, which is the first milk that a mom breast produce, newborns have very tiny stomachs. So you'll see, I got only this much milk. but you do not know that this much milk is sufficient for your baby, because your baby's actually stomach is no more than a ping pong ball. So your baby will be happy with that. So just do not worry about it. Breastfeeding, of course, the thumb rule is that it's either, you feed them every 2 to 3 hours, or you feed them on demand. Another thing is that as babies grow, this frequency becomes every 3 to 4 hours. So trust me, those days will come. But the initial days, yes, the baby will be more feeding on demand. Human milk changes to meet a baby's nutritional demands, which is a fact. A lot of mothers, your body is wonderful. Your body is like amazing because it knows how much your baby wants, and it produces the fattier milk according to what your baby needs. So, moms, you are amazing. And breast milk comes in 3 stages. The first, it starts with colostrum, which is basically the first milk. It's a pale yellow milk, which is produced by your breast. And trust me, that is great for your baby because it has all the antibodies and everything that your baby needs. And it also helps them to pass meconium, which is their first poop, which is actually black. But don't get worried about it. And then the transitional milk comes something from like 2 or 3 days after birth till 2 weeks. And mature milk is after, which comes after 2.5 or maybe 2 weeks, 2.5 weeks. But what I wanted to tell you was that breast milk actually changes according to the way your baby grows. So think about this, moms. When we come to our next screen, we are talking about 3 to 6 months. So 3 to 6 months, your breastfeeding behavior changes. How? It changes by one, your baby is growing up. Your baby is now, so you and your baby have set up a breastfeeding pattern. Before there was no pattern. Now there is a pattern. Your breastfeeding baby will also take less time to feed, and but it may also come more to suckle on your breast just for comfort. So you have to know the difference between when baby is, just coming for comfort and when baby is coming for feeding. And if any of you have questions on that, I can definitely reply. Feeding time decreases, as I said. Weight gain is normal. So weight gain is normal means weight is gained properly, it's going up. And this is something which your pediatrician will tell you whether the weight gain is getting normalized or not. If it is not, then you will have to consult your pediatrician and see what else can you do. There should be adequate amount of wet and dirty diapers. So we always suggest our moms, if you have like 6 to 7 pee count, baby is pooping, but sometimes a breastfed baby may poop 3 to 4 times in a day or not poop for like a week. So both of these things are normal. So it is only when you see your baby is feeding well, your baby is playing with you, your baby is curious about their surroundings, because as they grow, they become very, very curious about their surroundings. They want to see everything. They'll follow you with their eyes. Trust me, it's cute, but yes, it's distracting also for breastfeeding moms. So here what we suggest is that in case you feel that your baby is more curious about surroundings, maybe feed them in a slightly darker, quiet room so they are more concentrating on their feeding. And once they are done, you can definitely, take them out, and where there is noise, where there is light, that's one of the things that you can do. Coming on to what positions can you actually, what are the breastfeeding positions? So some of these positions are good for moms who've gone through C-section. So if you do not want any kind of sort of pressing on your incision and stuff like that. So the laid back position or the sideline position is very nice. Otherwise, you can use the cradle position, the cross cradle if you see, or the football hold. All of these positions are depending on what's comfortable for you or your baby. The last two positions are more if you've had a C-section and you do not want anything which is pressing on your stomach. That is why you want these positions, and you can. The idea is that please understand that whenever you're breastfeeding, it should be in a position where you're comfortable. If you are not comfortable, you may have like a, like an arm hurting, you may have like a back hurting. That shouldn't be there. Frankly speaking, if any of the pregnant moms are attending this session, we always suggest that before your delivery, make a nice corner for yourself where you can breastfeed your baby. It's a comfortable chair, there are comfortable pillows, you have a small side table next to you, you have a bottle of water, you have healthy snacks on it, and you have a proper rest, foot rest also. So trust me, you'll need all of that. Some people, some women like to use a breastfeeding pillow, and sometimes you can use your own pillow like a normal one. Again, it depends on your comfort. So, but make sure that you're comfortable. If these sessions go on long, trust me, you don't want to be uncomfortable. You don't want to get a backache and anything. So these are just suggestions. You can always ask me more questions at the end of the session. Coming on to why breastfeeding. We talk so much about breastfeeding. Um, World Health Organization recommends, AAP recommends, we are recommending, we are having a session on breastfeeding. There are benefits to it. The breast milk is actually just the right kind of food for your baby. I'm again saying it's the right kind of food, but that doesn't mean that if you're not able to breastfeed, formula isn't. But formula may come close, but it still doesn't have everything the breast milk has. Yes, if you can't breastfeed, then it's okay. Benefits for the baby here, it actually prevents diarrhea, pneumonia, asthma because your breast milk has so many antibodies. So even if you are sick, of course, except some diseases or some illnesses, we always tell our mom if you have fever or whatever, you can still continue breastfeeding your baby because the benefits exceed the risks. It actually cuts risk of SIDS. SIDS is called sudden infant death syndrome, which even till now, a lot of research is not able to say why this happened, but it definitely cuts risk of that. So that is something that you may definitely think about it. It lowers risk of developing allergies, and even obesity. Breast milk is right for the baby, and the fact is that it's easily digestible. So your baby health is really more, like more able to not have this obesity or stuff like that because you're not feeding either too much formula, because sometimes even the baby doesn't know how much it's being overfed. Coming to benefits for mom, it definitely lessens risk of breast cancer, ovarian cancer. It actually helps your uterus to, that involution to go back properly. It helps in, it actually prevents postpartum depression. You're more closer to your baby. Of course, you're bonding with your baby while you're breastfeeding, and it reduces stress. So think about all the benefits that you have for your mom, you have for your baby. And trust me, I mean, seeing your baby grow on your own breast milk, there is something good feeling about it. Well, a lot of moms struggle with a latch for breastfeeding. On our next slide, I'm showing you that. A lot of moms struggle with this proper latch. Because of that, they have a lot of problems. They'll have, like they'll have problems like sore nipples. They'll have cuts on their nipples. Their baby is not feeding properly because the baby is not latched on properly. And if you, this is just my suggestion. This is just a way to show you how to latch your baby. But if you are finding difficulty, please just talk to a lactation counselor. Okay, they will help you. Trust me, this will be better because a lot of moms leave breastfeeding also because they feel that I am not able to latch my baby. Okay, this is actually the way to properly latch. So, first of all, your baby's mouth should be wide open. The baby should not be suckling only on the nipple. They should have a huge part of the areola, which is surrounding the nipple, in their mouth. And their lower lip covers more of the areola. So, as you can see in the picture, first you actually tickle your baby's lips with your nipple because they'll get the scent of your breast milk. Make them open their mouth more wider and then latch on your baby. Always remember that if your latch is not perfect, you will have issues. So we don't want that to happen. Consult a good lactation educator, lactation counselor, consultant. Please do that and sort out this. Oh, so coming on to our next screen, there are a lot of things which a mom says all of a sudden my baby is not feeding properly or steps like or things like that. First of all, we always suggest that you cannot ignore your health just to take care of your baby. You have to take care of yourself. Moms, you are equally important in this. Another thing we always suggest, please do not have too much of caffeine. That actually goes into your breast milk. Smoking, absolutely a no-no. You're stressed about it. Moms are so stressed about my baby not getting enough milk. My baby is not pooping, not peeing. My baby didn't sleep today. If it's a one-off thing, it's normal. But if it happens again and again, then if you are stressed, it's always best to consult a doctor and get the issue solved rather than you taking too much stress about it. There may be certain medications that you may have to take that may reduce your breast milk supply, but then you can always tell your doctor, can I have something which does not affect it as I'm a breastfeeding mom? You can always consult your doctor about it. Not watching your diet is absolutely a no-no. Please eat properly. If you remember, I said that please have a bottle of water next to you, have some healthy snacks next to you, create a comfortable position. So if you are hungry, if you are thirsty, you cannot get up because you're breastfeeding your baby, don't do that. Keep some dry fruits, keep some fruits, keep a healthy snack next to you, and definitely keep a bottle of water next to you. All these will actually help you to increase your breast milk supply. But I can tell you some more things on my next slide, which will actually increase because this is a very, very common question. How do I increase my milk supply? So we try to have different things. We do a lot of things, and I know moms genuinely struggle with this. So my first suggestion, keep a water bottle next to you all times. You will feel very thirsty. Breast milk is the major content is water. Pump after nursing. Sometimes what happens is that your baby has not removed enough milk from the breast and your baby is taking a long time. This could be actually for premature babies. Anybody who's had a premature baby in our session who's watching, sometimes premature babies do not have the strength to remove milk, to suckle a lot. This will definitely help with premature babies. Try power pumping, which is pump 10 minutes and then do 10 minutes more. And you can actually feed that to your baby. And that will help you actually with your time, and also the fact that give your baby that breast milk which you have pumped without them having to work for it. Yes, definitely the more breast milk you make, the lesser formula you give. Check with your latch, which I suggested. Definitely check with your latch. Sometimes just do skin to skin with your baby. Just cuddle them up, and trust me, your milk will flow. Look after yourself for sure. If you are not resting enough, if you are stressing enough, all these are going to actually reduce your milk supply. And if you do, which I think you should, it will definitely help you in actually having a much, much more good breastfeeding relationship with your baby. Then we talk about, okay, putting your baby to your breast, like feeding on demand. There are some foods which can definitely help you, like with lactation. But to be very honest, we do tell you to have a more balanced diet, which will have everything. So these foods are also included in that. And of course, then you can try to definitely do breast compression. Like if you compress your breast sometimes, or even if you apply a warm compression, it helps to actually, let the breast milk flow. And sometimes, yes, babies come for comfort, but they also come to increase your mama's supply. And the biggest thing is that your breast milk actually works on demand and supply. So the more you attach your baby or the more you pump, your body will actually make more of breast milk. So this is just some of the things that you can try. And I'm sure that they all, if done collectively, can definitely help. Then we talk about what is a nutritious diet for our breastfeeding moms. Yes, you should have a balanced diet. Like for people who are pure vegetarians, of course, the diet will be different. I cannot tell you to have like a lean meat, or I cannot tell you to have eggs or fish. But for moms who can, this works. Okay, whole grains, bajra, jawar, wheat, whatever suit you, but whole grains. And I'm not talking about processed. I'm talking about cereals. I'm talking about legumes like dal, rajma, uh, what you call. But again, there are some chole rajma which may actually induce gas in you. If it does, you can avoid them or you can have them in little portions. But you can definitely have like a moong dal, tur dal, green moong, which is sprouts, which is more lighter for you. And of course, they should be cooked well. Raw foods, we actually tell our moms to avoid. Alcohol is a no-no, of course, for obvious reasons. Dairy products, yes, there are some moms who can have milk. There are some moms who can have maybe yogurt. You can have a smoothie, where I'm not talking about adding sugar because good fruits have enough sugar in them. You can have a lovely smoothie. Actually, that can be one of your healthy drinks when you're breastfeeding. So have plenty of fluids. I've already said that water is something to be included. Have a nice, maybe a vegetable juice. All this will help you to actually get your own strength back. You have also gone through a lot. And you still have to maybe, take care of your baby, breastfeed them so many times, you're sleep deprived. All these things will definitely help you in at least taking care of yourself and your baby. So, moms, if you still want to ask questions on this, you can, at the end of the session, you can ask us. Some of the nutrition tips, I would suggest get adequate fluids. Fluids is very important, already said. Have variety of foods. I know in a lot of places they say that no, you're supposed to have only these colored kind of foods. Not really. You should have all colored kind of foods. You see our plates, they're all colors. So you need all this and take in enough calories. Moms, do not go on a diet. I know you want to get back to your pre pregnancy weight, but please, it took you 9 months to get to that weight. Give yourself some time. Don't go on a diet. Stock up on healthy foods before pregnancy. I would always suggest before your, sorry, my bad, before your delivery, please go and stock up on healthy foods. So once you're back home, you have them. And if anybody says, I can cook meals for you, please just take their help, take their support. Friends and family can do that for you. And please just besharam ban ke le lena all the support that you'll get. You will need it. Trust me. Avoid too much coffee, tea, and sodas because they all contain cafes. Yes, you can have like maybe maximum 2 cups a day, limited quantity, of course. We all know you should be avoiding alcohol, smoking, tobacco use. Even secondhand smoke is not at all good for the baby. So please, if somebody is smoking, don't let them near the baby. Secondhand smoke is also bad. Keep that in mind, dear moms. Finally, I would just wanted to come to this and say that breastfeeding is easier when everyone steps up to support moms, including dads, including friends, including parents, grandparents. That's why I said when you get support, breastfeeding is easier. So if you are really a mom who's keen on breastfeeding your baby for a longer time, it helps. It helps for some moms to even see to it that their baby is taken care of while they can have like a proper bath, because I know moms just ignore themselves. Don't do that. I had a mom who was so worried about her baby that she was not even letting the support staff help with the baby. And the only thing she was worried about was that my baby is not getting enough milk. And she was actually just repeating the same thing. Trust me, you need the support to take care of yourself. So, as I said, if somebody brings you a home cooked meal, just take it. If your partner is helping you with the baby at night, you can actually pump milk, and your partner or anybody, your family member, can actually feed that pumped milk to your baby at night, and you may actually get better sleep. So, take all the support. And finally, I do want to say that when you start learning about all this before your baby is born, it helps you a lot. Because when you are in the hospital, you ask the right questions, you learn everything, and transitioning back to home becomes so much easier. So much easier. You learn about it, you ask the right questions, you actually plan when your baby comes home. And trust me, taking antenatal classes and learning all about breastfeeding and later on what happens postnatal will always help. Thank you. Thank you so much for attending our presentation. Thank you.
Thank you, Sushma ji. This was indeed extremely informative. We will now take questions. Mamas, this is your time to, you can either unmute and ask your question or put it in the chat box, and we can personally answer each one of them. So feel free to ask us whatever doubts you have regarding this topic.
Thank you, Palak. Would anyone like to ask any question?
I think the webinar got all their questions answered. It was indeed very, very, I feel, informative and comprehensive. So I think all the questions are done.
Sushma ji, Saloni, I have a question. Sunny here.
Yes, yes, yes. Hi, Sunny. How are you?
I'm good. I'm good. Thank you.
Yeah,
Happy Independence Day to everyone out there.
to you
And
as well.
Sushma ji,
Wish you the same.
thank you so much. Sushma ji, wonderful session. I really, it was quite insightful. Something new that I learned today. A lot of new things, in fact. I have a quick question actually, which came to my mind is what is about the diet part. Okay,
Yeah.
so let's say in case a mother, okay, probably she's diagnosed with diabetes, and if she's on a diabetic diet,
Hmm.
does she have to change her diet post delivery, or how does it work? I mean,
So if she's, I'm sure she must be on medication also, right?
yes, yes.
Yeah, she is. So what happens is that in these circumstances, of course, you don't want the diabetes to go higher. So you do have to change your. And was this gestational diabetes which happened in pregnancy, or was she a diabetic before that also?
Diabetic since before pregnancy.
Before pregnancy. Okay. So yes, then the diet does have to change a little because you don't want her insulin levels to go up. So along with medication, it was always be advisable to change her diet. Foods, avoid foods that, of course, which make her insulin levels go up. Okay. That can definitely, but we can help her with that. We can help her with a diet which actually is for a diabetic mom.
Okay. All right. Thanks, ma'am. Thanks for answering that question.
Most welcome. Pregnant with twins. I think we have a question in the chat.
Um, Somehow I'm unable to see the chat. One second.
Yes. So this is Vanessa, right? Am I correct, Vanessa?
Yes, yes, ma'am.
Yes. Vanessa, tell me. You can talk to me. Come on.
I think this is
Okay,
a direct
actually,
question. Yeah, sorry. Carry on.
uh, this I am pregnant now with twins, and I already have a toddler who is 5 years old. So initially, when he was born, I used to breastfeed him, but that was only for a week because he was diagnosed with jaundice after that. And so then, when he was hospitalized, I took a lot of stress and I used to cry. So because of that, I lost my breast milk. And then I used to exclusively only formula feed him. So I used to not breastfeed him. So I just wanted to ask, like, this time, will I face any problem like that initially, or like, will I be able to breastfeed my kids?
So, dear mom, first of all, congratulations. Okay.
Thank you.
You are
Thank you.
expecting twins now. You already gone through with a toddler. So you know that, you know what? First of all, if you actually went through my entire session, I have to tell you this that it doesn't have to be like that again. Okay. So you went through stress, you were aware of it, right? You've already had a first child. So the fact is that yes, this time you can breastfeed your twins. Okay, we can definitely help you with it. Another thing, this time you have to understand that in case there is any issue, there is always support for you. There is help for you. So, of course, stress can affect your breastfeeding. This time, I know it's twins. If I tell you don't stress, I may be actually overreaching it, but I would still say don't stress. And also the fact that because you are with twins now. How many months pregnant are you, by the way, now? Or when are you due?
Just I'm due of on the in the first week of September, actually.
First week of September. So maybe you have maybe another 15 days, 20
Yes,
days.
yes, yes.
Okay, okay. So till the time you have time, and you asked me because you're still pregnant. First of all, when you're in the hospital, as I said, work on it. Work on the proper latch. Okay, work on actually pumping breast milk because to be very honest, my friend went through this, and she had twins, and unfortunately, they were premature babies. I'm hoping you take it to full term. So what happens is because of premature babies, they take a long time to suckle, and that unfortunately takes a lot of your time also. So when you are in hospital, please learn to pump breast milk. That will save your time also, and you'll be also able to feed your twins. Okay, learn that. Buy a good breast pump, something which basically like an electric one, which will help you. And if I mean, you're attending this webinar and you are keen on breastfeeding your twins, you will be able to do it. Just, I would suggest in hospital, work on it when you have full support. See to it that you have support at home. And mom, I know with two babies, you will be stressed out, but really try not to. Try to take care of yourself also. And if your partner is there, if your friends are there, just take support from them and you will be able to do. There is nothing which is going to stop you from doing. Just do the right things. That's it. Just prepare yourself. As I said, you're sitting at home, right? So just
Yes, yes.
prepare yourself for a nice corner for yourself and for your babies. Do that and you will go through it.
Thank you. Thank you so much, ma'am. Thank you.
Most welcome. Any more questions? I think no more questions. I've answered everything, I guess.
Perfect. Then, once again, thank you so much for your time today and this wonderful webinar. I'm sure all the mums have really benefited from it. And thank you for all of you who have attended today. We'll see you in the next one. Bye.
Thank you so much, and everyone, happy Independence Day.
To you too. Bye
Bye.
bye.